Doctor, you're a mother and a pediatrician. That's why we've invited you on the show, because we would like to know actually whether you would send your kids to school tomorrow. We know that COVID is not lethal in kids. We know that now. Do we need to first vaccinate kids? Should that be a prerequisite for reopening? Because that is what Akriti Sagar, Vijay Jolly are both saying.
So let's understand this first once and for all, that WHO and a lot of these scientific bodies are saying that we have to de-link vaccination with school opening. There is no link between vaccination and school opening, because, and this has a lot of reasons. So as it is, we know that with vaccination, you are still prone to getting the disease. You are still prone to transmitting the disease. And even if there is disease in children, it's a very mild disease. There's a lot of data all over the world that children hardly suffer. The incidence of hospitalizations or mortality is extremely low. So it's very clear that children do not get any severe disease. Moreover, most of the world, 70 to 80% of the world has been open. The schools have been open for the last 2 years, and that time there was no vaccination. And in countries where vaccination is freely available also, countries like the UK, they haven't really gone, that they will not allow children to come to school if they are not vaccinated. In fact, they took their time to vaccinate children below 15 years of age. Even now, they have just started vaccinating children less than 10 years, have been almost constantly open throughout. So I think it's time that we realize that vaccination and school opening are two different things, because it should not be a prerequisite at all for opening schools.
Should we just assume and be prepared for the fact that if schools reopen, their cases will rise? We will see cases. I mean, and we can just, there's no panic then, there's no hoo-ha, because the benefits outweigh the risks.
Absolutely, absolutely, Sarah. When the schools will reopen, because there is Omicron around right now, and whatever little numbers also, children are likely to get, especially ones who have not had an infection in this wave or in the earlier waves, there is a likelihood that they might experience a mild flu-like illness, little fever, little cough, cold, which used to happen to children earlier also. It's like a mild
doctor,
infection.
Many parents are reporting that the kids have been facing high fever, right, for a few days.
Yes, high fever. Yes, because this virus, this Omicron strain particularly, is mostly it's harbored in the upper airways, in the nose and the upper respiratory passages, and it does induce a response just like another influenza virus or a flu, where you do get high-grade fever, and children are getting high-grade fever anywhere between 101, 102, 103, but it is settling down very much in the next 1 or 2 days or 3 days maximum. So nothing, as a pediatrician, as a pediatric endocrinologist, we have not seen any cases of severe COVID or COVID pneumonias in children in any of the 3 hospitals that I'm going to. So I think when we send our children back to school, we should be prepared a little bit that this might happen. But if we don't send our children back to school, we are already facing a pandemic of so many problems, lifestyle related problems, the number of cases of childhood obesity, type 2 diabetes,
all right,
bone mineral density, so many things are increasing. So it's time to, make a very informed decision based on science and facts. And
to make an informed decision and be aware, as the doctor points out here, that if you send your child to school, there is a chance that they will get COVID. If you send your child to school, there's a chance that other children in that class could have COVID. But as doctor says here, the benefits outweigh the risk here.